Bangladesh has launched an emergency vaccination program after a fast-spreading measles outbreak claimed more than 100 lives. The government is ramping up efforts to vaccinate children who are most vulnerable to the disease as cases steadily rise. Rana Flowers is UNICEF's representative in Bangladesh, and she joins me now from the capital, Dhaka. Rana, really appreciate your time with us today. Firstly, what's behind this sharp rise in measles cases in Bangladesh, and how and why did it spread so quickly?
Okay, so let's reflect a little bit first on the numbers. Last night, if you'd asked me, I'd have said we've got about 6,000 suspected cases, and today we're reporting more than 9,883. So we are seeing a very rapid spread that has affected every part of the country at this point. What's fueling the spread? It really is immunity gaps, and that is the result of vaccine outages. So the previous government failed to get vaccines into the country. They changed their procurement processes, and that has resulted in children not receiving the vaccines. So in the children that have been infected, what we're seeing is around about 72% of those have never received a vaccine. When the kids have received one dose, they're in a much better position, and that number comes right down to about 16% of the children. I mean, what's sad and absolutely tragic here is the majority, it's more than 80% of the kids are under 5, and we've even got a very high percentage of the children under 9 months, and they don't get the vaccine at this point.
Yeah, what was behind the failure of procurement, as you just mentioned?
Yeah, that's been investigated as we speak by the government to understand why they made such poor decisions in relation to timely vaccination, which they've done quite well over a number of years. You know, I've been with UNICEF more than 30 years all over the world, and this is the worst outbreak I have ever seen, and it's moving faster than I'd seen. They weren't helped by the fact that March was a major holiday period, so people were on the move, as we do, and that spread the disease across the various divisions of the country. You know, doctors also don't recognise it. So it took a while for them to realise they're not seeing allergies, they're seeing a major measles outbreak. And only now are we starting to see the numbers really roll in terms of just how many children have been affected.
Yes, and can you tell us how is Bangladesh's healthcare system coping, or rather dealing with this outbreak at the moment?
Okay, so you've got a system in Bangladesh that has been chronically underfunded over the last decade and a half at least. We talk about 5% of GDP going to health in countries. Here it was less than 1%. So you have a system currently under incredible strain. A lot of our work in the last week has been chasing down and visiting the hospital assessments, looking to see if they're triaging the kids as they arrive. They didn't have them isolated, so they were spreading it to other children in the hospital facilities. They didn't have ICU beds. You know, there was a case in the media this morning where the doctors were talking about something like 368 children waiting for ICU beds. And 91 of those children died. Now, they weren't just measles cases, to be clear, they're also pneumonia, but it really reflects stress and the strain on the system. And the biggest gap is in people. They just don't have the human resources at the moment to be able to deliver. So we're busily trying to employ people and get them out to the heavy burden areas so that they can start saving these lives.
Yes, and so can you tell us, about the rollout of this vaccine campaign? How is that unfolding as we speak?
Yeah, so look, we met with the Ministry of Health, so you've got a very new government, very new minister in place. We met with him late last week and discussed the fact this was much more urgent than we were seeing a response. The minister absolutely agreed, immediately said, that's it, we're rolling out vaccines. We had already brought in Gavi vaccines, so Gavi is the major provider, and they were in country, and they were there to do a campaign, which is like a catch-up vaccination in June, July, and we just said, you can't wait. You've got to go. You've got to do it now, and you've got to get the vaccines out. So the minister straight away instructed the staff. By Sunday, we had the first rollout of the vaccines, and the target, this first tranche of vaccines is targeted to 1.2 million children, 9 months to 5 years, or 6 months actually, to 5 years in the heavy burden areas. Today we've talked again and agreed they've got to do in parallel other districts that are heavily affected so that we can try and curb this spread.
Yes, and is there anything, just finally, anything that the international community can do to help?
Look, I think a lot of support is going to be needed. There's human resource capacity is critical at this point in time. We're making an appeal for funding, and that's primarily to be able to support the ministry and actually just complement the ministry in terms of numbers of staff. What's critical with measles is also the provision of vitamin A, because it really builds the resilience of the children and helps with the treatment. So again, we're also rolling that out across the country, but we're going to need more supplies of that as well.
Okay, Rana Flowers, we really do appreciate your time speaking with us today, and do wish you all the best with the important work that you are doing there in Dhaka. Thank you.
Thanks very much. Thank you.